This is part 1 of chapter 21, which is the child with respiratory dysfunction. So we're going to look at upper respiratory, lower respiratory, and then croup, which is really in the throat. So what causes upper respiratory infections in kids? Viruses mostly. The big culprit we see at the hospital is RSV. Some of your others are just a mild cold that they don't get hospitalized for, but RSV is bad. For those lower infections, pneumonias are often strep, that group A beta hemolytic strep, staph, mycoplasma, and then Haemophilus influenza. If you remember that from immunizations, we have an immunization against that. So the majority of acute illnesses in children are respiratory. It is the leading cause of reason for admit to the hospital, and if you're looking globally, it's the second cause of death. Pneumonia is for children, the first being infectious diarrhea. So who gets these illnesses? Well, under 3 months, there's not a big problem because they have maternal antibodies. And especially breastfed babies will continue getting those maternal antibodies, so they do better. Then 3 to 6 months as that maternal store of antibodies starts to wear off, we see infection rates increase. Toddlers, they get really high levels of infection because they put things in their mouths, they just don't have good infection control habits. And then over age 5, we see less of the viral and more, or the viruses start to decrease, but pneumonias with our group A beta hemolytic strep and mycoplasma increase. And then slowly it decreases after that just because they've been exposed to everything. They have antibodies against everything now as they get a little older. So why do kids have so much trouble with respiratory infections? Because everything's so little. It doesn't take a lot of mucus to block their airway. Your airway, think of it as a garden hose, and theirs is a straw. You put a little mucus in that straw and it's totally occluded. Things also move from the upper respiratory down into the throat and down out into the farther, deeper structures because they're so close together. They don't have to move as far. A little bit of spreading makes a big difference. And then the other issue is their eustachian tubes. Again, they're small, they're short, and they lay nearly flat. So they don't drain very well because it's not going downhill to drain. So they also can have less resistance, be more prone, more susceptible, because when you're young, you just have an immature immune system. So their immune system's affected either by age or other things like malnutrition, anemia, fatigue. A child who's never well rested is not going to have as good of an immune system. Allergies and asthma will make them more susceptible. Kids with cardiac anomalies, they can do really poorly with what for another kid would be a mild respiratory infection. Cystic fibrosis, this makes really thick secretions that they can't bring up, and those that mucus in the lungs becomes a perfect medium for germs to grow. And then daycare. Kids in daycare get sick more often just because they have more exposure. And secondhand smoke. This is really a significant factor in kids getting ill, particularly with respiratory infections. Probably inhaling secondhand smoke keeps everything a little bit irritated, a little bit inflamed all the time. So a mild illness is enough to cause big problems. So those of you who are smokers, don't smoke near your kids, smoke outside. So we do see seasonal variations, right? Colds are winter and into the spring. Mycoplasma, that happens more in the fall and the winter. Asthma, it really depends on the child. The most common season is cold weather, but some kids it's the pollens in the summer, some it's the molds in the winter, so each child needs to know their own triggers. And then RSV, that's the one we've got the season that's just really awful at Valley Children's. The hospital census goes way up, and that is typically in the winter into the early spring. For us, it's really when the fog is out. When the fog season starts, RSV starts, and when it ends, RSV ends. So what are the clinical manifestations, the symptoms we're going to see? They're going to be different with age, but in general, you're going to get fever. Now, we're talking about respiratory infections. Remember, you're going to get anorexia. These kids don't have an appetite. They may have vomiting. They may have diarrhea. They may have abdominal pain. Kids do not isolate things well. They swallow a lot of mucus and they feel sick and they vomit, and really what they have is an upper respiratory infection. And then cough, sore throat, blocked nasal passages, and those adventitious respiratory sounds. So what are we going to do? Think of your basic nursing care. We want to help them to breathe easier. So elevate the head of the bed. Run a cool mist humidifier at night. Treat their fever and their discomfort with Tylenol, using that nasal aspirator or bulb syringe to clear out their nose, especially before eating. It's really hard to breathe and eat at the same time if you're a baby. And then controlling infection, hand washing. Let's prevent these kids from getting illnesses as much as we can, which also means if they're playing with cousins or whatever, the kid who's sick needs to not be mixed in with the other kids. We need to clean toys between kids, all those sorts of things. Promote hydration and nutrition. Again, it's hard to eat and breathe at the same time if you're a baby. So we do want to make sure they're staying hydrated, and babies need to grow. They need that nutrition. And then family support and teaching. It's very scary for lots of families when their kid is sick. So let's kind of go down the respiratory tract now. We'll start with those upper respiratory tract infections. Most are just the common cold, nasopharyngitis, right? The nose and the throat are a little swollen and irritated, and this can be caused by all sorts of viruses. RSV being the one that we do see kids hospitalized a lot with, but some kids can get hospitalized with any of these, but usually RSV is more severe. With kids, we want to use that cool mist humidifier at night. We want to keep them well hydrated, but we do not want to give them cough medicine or decongestants. We want them to cough. We don't want those secretions pooling in the lungs, where they will now make a perfect medium for a secondary infection of pneumonia. And decongestants. Decongestants can have very negative side effects on infants. So you need to remind parents of that or tell them that and encourage them to read the label. Most decongestants say not to give to infants under 2 years of age. So I'm saying we want to encourage coughing. We want to get those secretions up, but the child who's old enough, we want to teach them to cover their cough. Don't cough towards people, cough away, cover it with their arm or a tissue, and then wash their hands and dispose of that tissue and wash their hands. How do we know if it's just a virus, which is not going to need antibiotics, or it is a virus? Our big one we're concerned about is strep, right? So viruses come on gradually. Over the course of the day, you start feeling yourself getting more and more congested. Bacteria comes on quickly. Viruses, you usually have a low-grade fever. Bacteria, it usually goes up quite high. Now, kids run higher fevers, and their fever goes up faster than adults. So occasionally, a kid will go up to 103, 104 with a virus. But with bacteria, they certainly will. Cold symptoms, you may start with a day of feeling bad, maybe a little bit of a sore throat, and then the cold symptoms come after a day or two. With strep, you don't have those cold symptoms unless they happen to also have viral upper respiratory infection, but they don't cause cold symptoms. You get some red enlarged tonsils with the virus. You get those same red and enlarged tonsils, but they also have the white patches, white exudate on them. With strep, there's usually also headache, very severe sore throat, and abdominal pain. Not just the upset stomach from swallowing a lot of mucus, but they usually have, vomiting and abdominal pain. You can get some swollen nodes, lymph nodes in the neck that hurt a little bit with viruses. You will get them with strep. And with a virus, you're usually moderately ill for 1 to 5 days. If you don't use antibiotics on strep throat, it will take as long as 2 weeks for your body to get the bacteria under control. And unfortunately, in a lot of cases, it migrates to either the kidneys or the heart and does permanent damage, which is why we really want to treat strep infections aggressively with antibiotics. Here's a strep throat right there. You can see that exudate on the tonsils. You can also see how large a child's tonsils are, and then because they're double adult size at this kind of kid's age, 6-ish, they'll shrink down after that. But if you have those large tonsils, and then you swell them up a bit, it really does and can block their airway. So that leads us to tonsillitis. So we will often take out kids' tonsils. We used to do everybody and that was around 1st grade when those tonsils are double adult size, and then they shrink back down. We don't do that anymore because the tonsils do have a function. Their purpose is to catch the germs, hold them in one place, so it's easier for the immune system to attack and kill those germs. The problem is some kids get recurrent infections where they really kind of become colonized. There's germs there that are just in a kind of a sub-infectious state all the time, and any little thing that lowers their immune system, it recurs back up into a full-fledged infection, and they can be contagious during that time. They're now carriers. They can end up with hypertrophy of their tonsils or the adenoids, so they just overgrow and get too long, or they can get an abscess. An abscess is a pocket of pus that stays there. Those are reasons to take them out. Usually when they take out the tonsils, they'll also take out the adenoids, which are just up the nasal passage a little farther. So this is our most common surgery for kids. It's done outpatient and we send them home. So we've got to make sure the parents are well taught about the complications to be looking for. The big one is bleeding. Those tonsils are quite large, and if the scab gets scratched off, they can bleed. What are kids going to do when they're bleeding in their throat? They're going to swallow it. So watching for frequent swallowing. All that blood in their stomach is going to make them sick. They may very well throw up. And if they throw up red, was that the red juice they drank, or is that blood? So that leads us down here. Avoid red and brown fluids, right? Because digested blood looks brown, frank blood looks red. And then they're going to be in pain. So we're going to do what we can to control the pain. Tylenol, an ice collar, soft foods. And the soft foods, it takes a couple of weeks for that surgical site to be fully healed. There is no rush to get these kids onto hard foods. We really don't want to scrape off the scab that's formed there. So chips and things, no. Keep them on soft food for, I'd say, a minimum of a week. And if they're not anxious to move on to hard foods, 2 weeks is just fine. Here's a picture of our tonsils. You actually have 4 sets. So when we talk about taking out the tonsils, it's these, the palatine tonsils, and then the pharyngeal tonsils up here are the adenoids that they usually take out at the same time. Because both of these can block that eustachian tube from draining, and then these are the tonsils that tend to harbor strep.